In 2009, the Department of Health issued the comprehensive 100% smoke-free environment policy, or Administrative Order Number 10. This called for an absolute smoking ban in DOH offices, hospitals, and attached agencies, while encouraging local government units to do the same in their health facilities and other public places. A year after, the Civil Service Commission then issued Memorandum Circular Number 17 on smoking prohibition, based on the smoking policy issued by DOH, but this time in all government agencies. As an offshoot, the DOH Red Orchid Awards was born, a significant milestone in the campaign for tobacco-free environments. The Department of Health Red Orchid Awards is a search for 100% tobacco-free provinces, municipalities, cities, government offices, government hospitals, and DOH Centers for Health Development. It follows the World Health Organization Framework Convention on Tobacco Control Article 8 that recommends adoption of measures to provide protection from exposure to smoke in indoor places, public transport, as well as Republic Act of 9211 or the Tobacco Regulation Act 2003 that provides protection from exposure to tobacco smoke. In the quest for universal health care, living a healthy lifestyle in an environment free of tobacco smoke is deemed important, especially for the huge majority of Filipinos who are non-smokers. The good news is more and more provinces, municipalities, cities, workplaces, and health facilities are making great strides in enforcing measures to protect the public from the hazards of tobacco smoke. The Department of Health deemed it once again fitting to pay tribute, recognize, and acknowledge these institutions and agencies that are committed to this advocacy for a 100% smoke-free environment. Categories. The DOH Red Orchid Awards highlights achievements in tobacco control in the following categories. 1. Local government units comprised of provinces, chartered cities, and municipalities. 2. Government hospitals. 3. Government offices. And 4. DOH Centers for Health Development and DOH hospitals. Criteria for judging. The winners are judged based on their efforts to implement a 100% tobacco-free environment using WHO's Empower initiative. Empower is an acronym that denotes the 6 proven tobacco control policies, namely, monitor tobacco control policies, protect people from tobacco smoke, offer help to quit tobacco use, warn against the dangers of tobacco, enforce bans on tobacco advertising, raise taxes on tobacco. Each indicator is then rated accordingly. The scores for all indicators are tallied and given their corresponding percentage points. This becomes the basis for the type of orchid award each nominee receives. The white and pink orchids are given to the contest runner-ups, while the red orchid is given to the winner. Nomination and judging process. The DOH Centers for Health Development and hospitals are automatically nominated and shall submit their self-assessment forms to the DOH Central Office Awards Committee for validation. Those joining other categories should undergo the nomination process even if they were declared winners the previous years. Recipients of the Red Orchid Awards Hall of Fame, however, are no longer eligible for reconsideration. Interested LGUs, province, city and municipality, government offices, and LGUs hospitals shall submit their self-assessment forms to the DOH Center for Health Development, or CHD, in their respective regions for screening and validation. The CHD shall be responsible for choosing the best entries and nominating them to the DOH Central Office Awards Committee. The DOH Central Office Awards Committee shall conduct the final validation to the local government units vying for Hall of Fame awards and for the Red Orchid Awards only. The scores submitted by the CHDs shall be the basis for the awards of their nominees.